Few minutes late here. I'm Dr. Michael Gardner, an orthopedic surgeon at Stanford University in California. And I personally worked with over 20,000 patients and performed over 8,000 orthopedic surgeries. I couldn't be more excited to be joined today by Karena Thek. Karena?
Thank you. I am a scoliosis patient. I am Karena Thek. I am also the founder of the largest scoliosis-specific exercise school in North America. We are, over the last 10 years, we have helped over 25,000 patients. And when I say we have a team of 80 plus exercise practitioners that are practicing scoliosis realignment therapy. We have helped them to eliminate their pain. And of course, you know what happens on the days that you're not hurting and the weeks, and can you imagine even the years, you get your life back.
Thanks, Karena. So by the time you leave this webinar, you will understand the root cause of your scoliosis pain. You'll know how to realign your body without surgery, and we'll show you a plan on how to live without scoliosis pain. Our team of doctors from Stanford, Mayo Clinic, Johns Hopkins, and other top medical centers have worked with approximately 100,000 patients combined. And there are two avoidable realities we see day in and day out, because patients have not had appropriate access to scoliosis realignment therapy. The first is that many scoliosis surgeries could have been prevented with earlier action. And the second is most adults live with pain for decades that has the possibility of being eliminated. So with all this needless suffering, we've gone to great lengths to unite many of the top scoliosis experts in the country to reinvent scoliosis care. So the first thing I want to mention is that if you haven't been effective in navigating the healthcare system, it's not your fault. The healthcare system in the United States is not designed for scoliosis patients. There's a lot of outdated information out there. There's a lot of incorrect information. And really, patients are not adequately educated in the benefits of non-surgical scoliosis care. However, with the right information and tools, you can be victorious in this fight. And there's a good reason to have hope. So if you felt lost or unsure who to turn to in the past, we're here for you.
So the question then is, what are your dreams? What are you ready to get back to? What's been sidelined for you? Is there an organization you want to be a part of? Is there a family waiting for you? Are you sidelined to the outside and having to only watch while the rest of the people around you are doing? It's there. It is waiting for you. I have a patient that once said she feels like a ghost in her family, and that doesn't have to be you. You can be a participant and always be present.
So my journey started way back in 2001. I was an energetic young doctor at the top orthopedic surgery residency in the country, and my mentors at a hospital for special surgery in New York City taught me how to become a world-class surgeon. During my residency and my training in spine surgery, I would hear a lot of spine patients tell their stories about how the system had failed them and how they ended up needing a life-changing surgery that, looking back, was potentially avoidable. So over the subsequent years, my curiosity turned to anger when I continued to learn more about the same gaps in care leading to the same adverse outcomes, including two close family friends who were dealing with pain, poor function, and body asymmetry and cosmetic issues because they didn't know there was a better way to manage their scoliosis. One example is my friend Kimberly, who for many years had no idea where to go. She's about 50 years old now and has lived with intense back pain and noticeable asymmetry. One of her shoulders is much lower than the other, and it's very obvious from the moment you see her, even if she's wearing a jacket. She's very self-conscious and wearing dresses and isn't able to fully play with her kids or play sports. And she's just getting started with us at the National Scoliosis Clinic. So I came to the conclusion after all these years that the scoliosis care system is broken. Like Kimberly and the hundreds of millions of people around the world that are affected by scoliosis, this motivated me to better understand the main ways that the system is failing patients. I sought to better understand the most common negative outcomes and ultimately the barriers that cause those outcomes. So in my quest to deeply understand these barriers to better scoliosis care for patients, I spent years interviewing and learning from scoliosis specialists from around the country. Here are some of the most common problems that I found with the current system. Patients lose countless hours researching and visiting specialists, and the trial and error rarely leads to patients getting what they need. Patients often have a lifetime of pain because they can't get the proper help. Many doctors default to prescribing opiate pain medications for back pain, which often leads to harmful side effects, as many of us are aware of by now. On some occasions, patients end up needing a surgery, which, as I mentioned, are potentially avoidable. And today's scoliosis patients are left with limitations such as not being able to play with their kids or grandkids. They lose their range of motion. They have a hard time imagining life without pain. So in putting all this together, really, it struck me and our team that all of these problems are avoidable if we could reinvent this system. So in order to reinvent the system, we needed to fully understand what these barriers were. And the problems we found are most doctors and specialists aren't scoliosis experts. Many will tell you there's nothing you can do. True scoliosis experts are rare, difficult to access. Some live far away and cost a lot of money. The treatment they provide is eventually unaffordable. And then interestingly, the healthcare industry has a lot of backwards financial incentives where essentially surgeons make money by doing operations. And so that's why preventative management for scoliosis isn't prioritized in many cases. And then finally, there are a lot more scoliosis patients than the supply of true scoliosis experts, which makes navigating this even more difficult. So speaking of the amount of scoliosis patients, you probably didn't know this, but there are more than 65 million American adults with scoliosis, and most of them aren't even diagnosed yet. 68% of people over the age of 60 have scoliosis, and 38% of adults over 40 have scoliosis. So if you have pain from your scoliosis, you can be sure that you're not alone. Scoliosis is pervasive and a very painful experience for many. Throughout my years on this quest to reinvent scoliosis care, I've talked with many experts around the country, but of all the experts I've learned from, the most knowledgeable and effective person I've met on eliminating scoliosis pain is Karena Thek. So Karena has founded and oversees the largest scoliosis realignment therapy institution in North America. These realignment practitioners have eliminated pain for over 25,000 scoliosis patients.
Thank you for that, Dr. Gardner. I am privileged to have met you, truly. I do have a long history of scoliosis related pain. In fact, some of my earliest memories are back pain. And then I decided that was just how people lived. They lived with back pain. I mean, grandma had Bengay and I used Bengay. So it's just how things were. Instead of being able to eliminate my pain as a child, I decided to move forward with it, threw it on like a backpack and continued to study dance. That was my passion as a child, was to be a dancer. I did go on to have a professional dance career, and the pain, I can't say it was manageable, but we worked together, me and the pain. We danced together. We did everything together. There did come a point though where the pain was debilitating, and I literally couldn't walk. I was getting carried around. But then as a dancer, we don't have a second string. There's not a lot of people waiting backstage to take your place. And so I did perform. That probably, well, it did cause more damage for sure. There was no treatment. There was a lot of shrugging of shoulders and a lot of generic plans for me. And so I stopped dancing. At that point, after I stopped dancing, I discovered a historic therapist. So this woman was before my time, and she had scoliosis and created a plan for herself in terms of realigning and using exercise. And so I tried it myself, and I found that my pain was gone in 2 weeks. And I thought, well, that surely is a coincidence because I've had this pain my whole life. Today was, the magic day when things were finally going to disappear. And so I stopped doing the exercises. And then the pain came back. And then I started doing the exercises and the pain went away. And you would think that after twice I would have gotten it, but it took a few more cycles of this before the light dawned. And I thought, oh, it is indeed a result of the exercise and the work I was doing, that I was doing better. I did volunteer my time for 18 months, probably more than that, to see if the exercises that I was doing would be effective for anyone else with scoliosis, and they absolutely were. We saw time and again people coming in to work with me where the pain was debilitating and the pain went away and they got back to their life and we never saw each other again. It was truly amazing. At that same time in my life, as Providence would have it, I was asked to host a TV show. I was asked to host a radio show. And through those, even though the topic wasn't scoliosis, through those venues, I was able to share a little bit more about scoliosis and how we can resolve the back pain. I was shocked at the amount of interest that there was in scoliosis treatment in terms of exercise, in terms of something conservative outside of surgery, outside of bracing, and people were flocking from all over the world. And it took a long time, but the light bulb moment finally came. And that light bulb moment was, oh, it is not about strength. It is not about, doing the right cardiovascular exercise. It was all about the alignment, and it took realignment to change the pain. And also the light bulb moment was that, wow, it was in my hands and I had the power to take care of this. I either do the exercises or I don't. And as you heard a moment ago, I went through that cycle a few times. So in any case, my life and my career were transformed. I was in a lot of pain. I did leave my dance career. And then I went on to move freely and happily. I was physically active again. Woohoo! And there's young Karena. So for the last 15 years, I've chosen to focus professionally on this paradigm change. It's not easy to change a paradigm. I think I should do a TED Talk on 5 difficult, almost impossible ways to change a paradigm. But then there's Dr. Gardner, and this is a big part of why we're able to make this change now. My goal was to help others improve their alignment, but not just their alignment, but to eliminate their pain and to avoid those years and years, maybe decades for many, pitfalls of scoliosis. And the whole goal is so that they can pursue their passions. I think about myself and what I would have been capable of if I still had those high levels of pain. And I know I wouldn't be sitting here and talking to you for sure. So we come along then to the 3 secrets that we have learned over the years. And we call them secrets because, like, who else knows this? It's something we consistently have to share. It's not common knowledge. And the secret number 1 is that it was misalignment that was causing the root of the pain. Since many, in fact, you could say most Americans develop scoliosis over their lifetimes, most Americans end up with very avoidable back pain. Later in our time today, we will speak about how the misalignment in the spine to the left results in pain for this patient. And those lines you see there are just some indications that help us see that things aren't quite aligned. The lines on the left don't quite match the lines on the right. There is a misalignment cycle that happens. So as you can imagine, once misalignment begins, like if I sit here talking to you, if I sit and slump into my curve, even though that's an exaggeration, that's where I go, that's going to result in pain because the building blocks of our spine are meant to be lined one on top of the other. They're not meant to swivel and spiral. That's harder for the tissues to support them. So that results in a destabilizing pattern. If you have a destabilizing pattern, that's going to take us back to even more misalignment. That misalignment leads to pain, back to destabilizing patterns, and around we go on this vicious cycle. And for you, as you're watching the webinar, if you have scoliosis, if you're not watching this for someone that you love that does have scoliosis, think about the amount of time you do spend in a chair. And think at this very moment, if you're sitting evenly on both sit bones, those hard bump bones that you're sitting on there. And most scoliosis patients will sit primarily on one side or the other, partly for comfort because of the misalignment, partly because we're misaligned to begin with. But even in the chair example, you see that vicious cycle beginning there. Not all problems that stem from the misalignment of scoliosis result in back pain, which is interesting, right? You'd think, wow, if my spine is curved, then the pain must be at the worst part of that curve in my spine, and it's just not true. It could be anywhere in your body. It could be a knee pain. It could be hips, shoulders, neck, jaw. But what we see very commonly is that we have some co-conditions that come with scoliosis, osteoporosis being a major one, because maybe as a child, those prime bone building years, you had scoliosis and you were not the most active. You chose to avoid pain. And so our bone density bank doesn't get built up. A lot of us with scoliosis have hip and knee. We get tears in the ligaments or in the tissues that surround the joint, or arthritis build up because of inflammation. We have rotator cuff damage in the shoulders because we can't quite lift our arm as high as someone without scoliosis. And so we're trying to get up there, trying to reach the top shelf of the cabinet or the golf swing or the tennis swing, making it perfect, and it ends up in a tear there. We frequently end up with bulging and herniated discs, a sacroiliac or SI joint pain that's in the center at the back of the hips there, and chronic inflammation. And chronic inflammation will just exacerbate all the issues you see there, specifically, and most importantly, the arthritic conditions. But it also can lead to a feeling of malaise because chronic inflammation is something that your body has to fight day in and day out. It's not a one and done type thing for the next hour. It's a systemic thing, the way your body will live. So we take all of that misalignment and that cycle that can lead to this, and we look at the opposite of that, and we look at an alignment cycle. So we start to realign, and the moment we start to realign, we have more stability. It's instantaneous. It doesn't happen in 3 weeks. And then with the stability, we have freedom from pain. That can also be instantaneous. Sometimes others, it takes a little longer to kind of weave it into their body's system. And then that freedom from pain actually does lead back to more realignment, because if you don't have pain, then it's going to be easier to find that realignment advice that was given to you in your realignment therapy. Again, that leads us back to more stability, more freedom from pain. And when you have less pain, it starts to also unwind the whole neuromuscular, psychological, sociological pain cycle. So now we have this virtuous cycle as opposed to the vicious cycle. It's going to lower your odds of injury. This cycle is going to improve your sleep. It's going to improve your symmetry, your range of motion, and that's just to name a little bit. It's mostly just there to get your life back. And speaking of getting your life back, we have Lisa. And Lisa quotes, "My pain was mostly gone 3 weeks into my realignment exercises and 100% gone after 2 months." This is a real thing. This happens all the time. And Lisa will continue to do her exercises. It's not like, oh, I did it for 3 days and now I can stop. And oh, the pain came back, so it must not work. No, this is a consistent thing, like brushing your teeth, but it's worth it. There's no pain. And yeah, the skin keeps aging. You saw young Karena a few slides back, but the bodies feel better, very frequently better than they did decades ago. I'm living proof that today I am walking, whereas before I started this type of therapy, I had a lot of difficulty walking and certainly gave up my career. That leads us to secret number 2. And secret number 2 is that your body does want to heal. It is made to heal. That's what all of that stuff underneath your skin does, right? It is made to keep a status, healthy status quo going on. Imagine you're in the kitchen and you cut your finger, and you need everything that you need to heal. And instead, imagine you go outside and you take that cut finger and you rub it on the street, and there's broken shards of grass, and there's who knows what kind of bacteria living in there, and now you've got dirt and grime and gopher guts and the whole thing now inside your finger. That's not what your body needs to heal. It's like the exact opposite. So unfortunately, given taking that analogy into our scoliosis healthcare system, we're often given things that are the exact opposite of what our spines need to heal from the pain and to regain function. We're given things that are outdated, incomplete, and unfortunately harmful. This is our disempowerment cycle here. We begin with, doctors that can't help. They honestly just don't know how to help someone with scoliosis. And there's that advice that's wait and see. If it gets worse, we'll do something about it. But right now, your numbers are good, even though you might be in a tremendous amount of pain. Then we go to seek our own solutions, right? And then we go to a chiropractor because this is bony. It must be something a chiropractor can help us with. It's harmful because with chiropractics, we very frequently get hyperextension and an over-rotation of the bones of the spine. Our bones with scoliosis are not shaped individually the same as someone's bones who does not have scoliosis. It's not just that they decided to curve, they've actually changed their shape. And so doing these types of manipulations can be extremely harmful. Now we have more misalignment and more pain due to a harmful solution that we tried because we thought we were doing the best we could for ourselves. That might lead us to a generic physical therapy, generic PT. I certainly have tried both of those solutions. And the problem with generic PT is that they want you to do exercises to strengthen the spine. That's fabulous, but our spines need to be moved into a better alignment first. So it can be very harmful for me to try to exercise my spine within its curve. What does that lead to? It leads to a curvature that increases. And if the curve increases, the pain increases. And then often we end up with a surgery that could have been avoidable. Okay, greater alignment is what is going to unlock the healing here for us. We need that better alignment, the realignment therapy, to move away from that disempowerment cycle. That's part of that vicious cycle that we walked through just a moment ago. And if you take the analogy of the cut finger, instead of heading out the front door and rubbing it on the asphalt, maybe you would put some ointment on it. Maybe you'd wash it before you did that. Maybe you'd put a Band-Aid on it. I mean, this is all very logical to all of us at this point. But what's not logical is what in the world do you do for scoliosis care? Let me give you an example of what that greater alignment looks like for a few people specifically. We'll start with Sarah. Sarah was in the Secret Service, and she also is an avid climber. She came to me because she was in a tremendous amount of pain. She wasn't really worried about ever climbing again. She just wanted to knock the pain down. It was a good 8 to 9 out of 10 on most days, her pain levels. And she just wanted to knock it down to maybe a 4 or 5 so she could actually have a conversation with a friend without crying. And so she wasn't concerned about the climbing. But when I saw her and we started doing some realignment, I saw with Sarah that it was very much about what's happening in the pelvis and how we realigned the position of the pelvis to her low back, and very specifically how she was holding her rib cage. And once we made some corrections there, I could see on the very first visit where this was headed, even though she couldn't quite see it. But at the end of the first visit, we made an appointment or we put a date on the calendar and said, okay, on this date, you and I are going to the climbing gym together. And that was like the most bizarre thing to her, but we did it. I think it was about 2.5 months after we started. We had a date at the climbing gym, and she taught me to climb. I watched her climb. She's an amazing climber. So not only did she eliminate her back pain, but she got back to climbing, and that wasn't even remotely her goal, which is fabulous. We move on to Marie next. Marie is not just a client of mine. She's also a very, very dear friend. Marie has had scoliosis her entire life. It's a severe curve that has worsened over time. And most recently, she's had some intense pain at the upper right side of her neck, to the point where she has to, in the middle of dinner, lie down on the couch. And she will lay there until that pain subsides. Then she jumps up and does everything that she wants to do again, goes back to having dinner with friends, or she's hosting a lot of dinners still at 91 years old. So she's got a lot of responsibilities to keep this dinner party going. Her exact realignment that we're doing for this exact pain she does it standing at the kitchen counter. And instead of trying to stand on 2 legs evenly, I have Marie stand on 1 leg, and she lengthens through this leg and puts the hips over the leg, and then the ribs over the pelvis or the hips, and then the shoulders, and then the head. So it's very much about getting tall on 1 leg and then getting tall on the other leg. And that actually relieves the pain immediately. And it's better than lying down on the couch to relieve the pain, because now we're building strength around the realignment. So she did eliminate her pain. She is back to doing what she loves to do. Yeah. Okay, so then let's see, who else do I have here for you? Yes, we have Michelle. Michelle is in her 70s now. When she was in her young 70s, she was given about 6 months to live. Because of the scoliosis curvature, her lungs and her heart were being crushed. She had quite a severe curve. She had quite a severe curve. She has since had surgery. She was originally told she was not a candidate for surgery because I'm not sure why. She was just told she wasn't a candidate. It wasn't because of her bone density. I think it was the severity of her curve. So she was given 6 months to live. She said, well, I've got to do something. So she talked to some more doctors, and then she found a doctor who was quite confused about why she wasn't offered surgery. Like, why? You're good, you know. Anyway, she had surgery. She's doing incredibly well. After the surgery, she continued with her realignment therapy. And the reason that's important post-surgery is because the curvature above and below the fusion, they still need assistance in realignment. Otherwise, the fusion comes in to hold the curve, and the bits and bobs of bone, the vertebrae above and below, they don't know yet that they're supposed to go back. And so they just need they need a roadmap, you know, a little GPS action that says, hey, maybe join the newly aligned spine over there. It happens a bit on its own, but it's way more effective if we work together on that. So she is back to walking her dog. She is breathing just fine now. It was getting to the point where before surgery, she couldn't walk the front stairs of her house, and there's only 3 of them, 3 stairs. So she's back to walking her dog. She's doing great. And most importantly, even more than her puppy dog, is that she's playing with the grandkids again. So she's living a really good life. We could not be happier. I know she's even 100-fold happier than we are, of course. From Mary, every week I regained more flexibility. Today I can do everything I used to do in my 30s. And regaining flexibility is an interesting word. It's how Mary sees it. But from our standpoint, what we see as flexibility is kind of an ease of movement. You're not like stuck in this position. So that flexibility shows up because of the realignment. There's more space, there's more ease, there's more fluidity to the movement. Okay, now I guess you're wondering, you've met Marie at 91, Mary here at 84, Michelle had surgery at 70, and you're wondering if this is something that you can do as well. And let me tell you that if you're watching this webinar, you can most likely do the scoliosis realignment therapy. And if you can lie down, oops, I skipped a slide. Let me just go back. Sorry, everybody. Take two. The secret number 3, because we covered secret number 1, which is the misalignment is at the root cause of your pain. Secret number 2 is that your body really wants to heal. Secret number 3 is that aligning your body is way easier than you think. And that is the really good news. And that takes me into where I was trying to run a moment ago. And that is that if you are sitting watching this webinar, then you most likely can do a scoliosis realignment therapy. You can do this exercise seated in a chair. If you can lie down on a bed, or if you can lie down on a yoga mat, you can do this realignment therapy as well. Some of our patients currently don't feel comfortable getting down onto the floor, and so we have them do it lying on their bed. Standing at the kitchen counter is also a popular place to do the therapy, because you have something to help you balance and hold on to. Even if your balance is stellar, holding on to something allows your brain to stop thinking about the balance. It's kind of given, and then your body can focus more on the realignment part of it. And of course, if you can sit on a kitchen chair, using a table or a kitchen counter to assist you while you're seated, is extremely, extremely helpful. You can also fit this into a very busy schedule. My schedule sometimes spins pretty fast. And so I do a lot of this sometimes when I'm sitting at my desk. I'll do my exercises sitting at a kitchen table or at a restaurant. If you're seated, you can do this, and it can go with you. You don't have to wait until you can get home and do this at 45 minutes at the end of the day. A lot of our people do this when they're brushing their teeth, or when they're cooking, specifically like washing dishes where you're not worried about burning something. Standing while you're talking to a friend or coworker, or during a phone call or remote work meeting. Pumping gas is perfect time. Waiting in line, awesome. And I can highly recommend that you weave this into your favorite activities, whether it's gardening, kayaking, or paddleboarding. Okay, then here we are. A pain-free vitality is a lifestyle. You don't get to do this, like we said a few slides back, twice and hope that that's going to cover you the rest of your life. It's like brushing your teeth. It's like washing your hair. It happens more than once to be effective. We have the vicious cycle on the left. We have the virtuous cycle on the right. And this health is a marathon. It's a good marathon. It's not one where you're like breathing hard at the end. It's something that is consistent and ongoing. It's not a sprint. If you're going to look for a quick fix, then you're heading back to those destabilizing patterns on the left there, and this just won't be the right program for you. If you're looking for a solution that can help you recover by tomorrow, okay, this won't work. But if you're looking for a solution that can live with you the rest of your life so that you can live your life, then this is definitely the solution for you. We talked to Michelle, age 46. It actually works. Yeah, it's part of my life instead of taking me away from my life. And that's the whole crux of it. It is to get your life back. And then as we move forward, I'm going to turn it over to Dr. Gardner.
Thank you so much, Karena. Really, really interesting stories, compelling information. So as I told you earlier, the years I spent talking with scoliosis experts, trying to figure out what it would take to reinvent scoliosis care, I came to the conclusion that really there were 3 components that we needed. First, we needed patients to have available to them scoliosis realignment therapy that's effective and affordable and available to everyone, regardless of where they might be. Patients also need holistic support, So not just the medical or therapy side of things, but also the psychological, practical, emotional, and mental support components of this. But then finally, I really realized that patients needed a way to understand their unique anatomy, their own curve from the beginning, but also then be able to monitor their spines to assess changes for the better or the worst. And ongoing monitoring therapy can really help customize the programs. So we envision the analogy of a car, driving a car and its gauges without imagine driving your car without a gas tank gauge or an engine light check. It would really be pretty scary doing that. And really the same logic applies to your body. If you have pain in your spine, you need to take corrective action, but you can't see the progression or the severity, it's difficult to know if you're heading in the right direction or if you're going to run out of gas soon. So then after extensive planning in the early phases of the National Scoliosis Clinic, we realized that we would be able to deliver on the first two pillars of this, accessible SRT and holistic support. But we were still stuck on how to allow patients to assess their own unique curve. And then that all changed after my own path moved me west and I started working at Stanford in 2016. That's where I met Dr. John Vorhies, a current colleague of mine, world-renowned scoliosis surgeon at Stanford, and who now is part of the medical team of the NSC. First, we compared notes and realized that the same barriers to great scoliosis care that I saw on the East Coast also existed on the West Coast and elsewhere around the country. And Dr. Vorhies and I commiserated how it's really a shame that since the 70s, technology has been available to diagnose scoliosis without an X-ray, but the 3D scanning machines based on earlier technology have been large and expensive and positioned in doctor's office and really inaccessible to the average person. So we really lacked the easier potential ways for people to access convenient and affordable scoliosis scanning. So then we had an epiphany. If we could create software that historically had been large and inaccessible to work on a smartphone, then we could enable patients to measure their spines and their curves from the comfort of their home without seeing a doctor, without getting an X-ray. And so this occurred to us from the outset that this really was the missing link. Along with the scoliosis realignment therapy, this would allow us to provide better scoliosis care for patients everywhere. It could really transform the whole system as we have been seeking to do for many years now. So I convinced my wife to let me dip into a little part of our savings to start investing in this technology. And in the subsequent 5 years, I recruited additional investors who believed in my vision to reinvent scoliosis care. And to this point, they've invested millions of dollars to bring this vision to life. Today, not only is this technology working and active and accurate, we just received FDA clearance for this technology last month. So now all the puzzle pieces were in place, all under one umbrella, a scoliosis realignment therapy that's effective and available to everyone everywhere, holistic scoliosis-specific support with nutritional, mental, emotional, and practical components, and finally now, accessible AI-based 3D scanning software in the palm of your hand to empower regular spine monitoring from home. So going all the way back and kind of summarizing, reinventing scoliosis care, although we're not done yet, has been quite the journey to this point. Our larger team of doctors and realignment therapy practitioners have made hundreds of steps to keep improving the solution's effectiveness. For example, in 2013, Karena incorporated the latest science on fascia. In 2014, she incorporated the latest research breakthroughs in nerve science. And then in 2017, she incorporated the latest findings in cardiorespiratory issues in scoliosis as well. And not accounting for the rest of the team, reinventing scoliosis care has taken Karena and I a combined 40 years. So I hope you're feeling more hopeful about after hearing about how we've created a bridge to align your body and eliminate your pain. Personally, I speak on behalf of our whole team, we're all very excited. We often get questions at this point about the details of how to participate in this program that we have called the Scoliosis Solution. So I'll start sharing some details as to what the solution entails and how you can get involved. So first, overview of the picture is we have three main components to our solution. First is body awareness. Second is body action. And third is body hold. And I'll just touch on each of these briefly. So first is body awareness, the first component of the scoliosis solution. So understanding your spine shape as it relates to your pain and your function and your range of motion enables you, with our guidance, to help you take timely steps forward based on your current situation. So you're able to enhance your understanding for our team of scoliosis experts by reviewing your x-ray, if it's available, or a 3D scan, which you can take from a mobile phone from your home. So maybe we'll put Karena on the spot here and ask you, if you don't mind, giving the audience a demonstration of what your analysis of their x-ray might look like.
Happily. So when you join as a member, you will send your x-rays in. And what I'll do is take that x-ray and give you a little chat, a 10-minute chat on what's going on here. So when we look at the x-ray on the left here, we can put a line through the center of it, and that line automatically helps us clarify where the spine is moving. We saw the curve without the line, but with the line, we can see, okay, in the neck, we have the spine moving to the right of center, and the low back to the right of center. And in that mid-back area, really trying to line up through the center. The pelvis is living a little wider on one side of that center line than the other. And that red line in the low back there shows us how far off center from the center of the pelvis that low back is. We move up into the neck, and that's we've got the neck living couple of to 3 centimeters maybe off of that midline. And when we move into looking at the neck muscles themselves, we can see that they're not shaped the same from one side to the other. When we look at that, we see that the neck is potentially going to be quite a problem for this person because there's so much misalignment there in the tissues. We know that those tissues are holding on quite tight. We wouldn't be surprised to see or to hear that there was also some jaw pain going on. So yeah, there's a lot that we can see in this x-ray to tell us where to begin the realignment therapy most effectively. We see here there is a tip in the shoulders. The longest red line at the top tells us that even though the arms are up and you would think the hands are equally placed above, and they usually are when x-rays are taken, that there's still quite a tip in the shoulders and still quite a tip happening through the neck. Again, this misalignment at this level is trying to correct itself at the very top of the neck and into the head. And we talked earlier about Marie, who's getting that pain very high in the back of the neck here. And often the situation that we see in the neck on this x-ray is what's leading to that very high pain. Sometimes, again, the jaw, sometimes it can feel like it's heading into the ear. But yeah, it's a great opportunity. Thank you. Thank you, Dr. Gardner.
Great. Thank you, Karena. So now I just peeked into the chat as you were doing that, and there was a question, more information about the mobile scanning app. So as if on cue, here we have very brief demo. So this is about a minute, and I'll just show you. So download the app, open the app, and you use the front-facing camera. So you have a friend stand over you, quickly captures a three-dimensional image of your back. Here's a picture of your friend or family member taking the scan. It takes about 5 to 10 seconds. You inspect it for thoroughness, hit accept, goes to our cloud environment, our AI algorithm analyzes it, and then it gets sent to our team where we then analyze it. And Karena will just show you now. So this is what her team sees on the back end here.
Yeah. So we can tip the scan and see exactly, if we can't see something in the x-ray, then the scan is going to help us. And of course, we can't tip the x-ray this way. So we can really see which side of her upper back here is higher, which side is lower, and where we're going to focus our attention in terms of the realignment therapy. For this patient, our primary focus is going to be that upper back, so like above bra strap area, but also the realignment in the hips. Is both of those things together are going to help us start the best realignment therapy for her. Generally, we start not at the easiest spot, like what's easiest to realign. We start with where it's most difficult to realign. And if it's most difficult, then the bones and the alignment above and below tend to be like, oh, well, if that one is going to go back to center, then I guess we'll go back to center too. They're more apt to realign. Yeah, looking good here. I love this app.
Yeah, thank you. Outstanding. So we'll move on to the second component after body awareness is body action. And so body action now focuses on the therapy that realigns the body through asymmetric strengthening, elongation, and breathing. Just like body awareness, there are some components that are on demand and some that are live. You can do the on-demand exercises wherever and whenever you want with a laptop, phone, or tablet, wherever you have internet access. And there's also some personalized feedback to how well you'll be or how well you are doing these exercises. We often get asked, how do I actually know if I'm doing the exercise correctly? Well, as you're watching the videos, one of our scoliosis experts will provide lots of feedback to indicate just how it should feel, how it shouldn't feel, etc. So obviously, this isn't as effective as having a therapist in your living room next to you, walking you through the exercises. And this is why you'll also have access to live office hours with our team of master practitioners, where they will give you feedback on any of the movements that you'd like to learn about live. In addition to scoliosis realignment therapy, we have a growing library of exercises that are scoliosis safe. They aren't focused on reorganizing your body like the other exercises, but have a lot of other benefits, and scoliosis safe yoga is one example of that. And the last, lost here. Let me jump. Okay, so those who have gotten into the program have often asked, well, where do I start? We've got a whole host of exercises. And so put this in here just to give you an example of some of the programs we have and how it relates to the specific situation you might be in. So first, for example, if your main issue right now today is pain, hard to sit, hard to stand for more than 30 minutes, we might recommend that you start with our specific pain program. Conversely, if you don't have pain, but you have other asymmetry issues or you want to prevent pain from occurring, program 1 might be best for you. And then we have a second program where you're maybe more experienced, you know your curves, and so we've got a more advanced program 2 for you. Okay, so now maybe we'll get into just a quick demo around body action. And we'll have Karena do a little demo on how an exercise in breathing asymmetrically might work.
Yes, thank you for that. Okay, so I'm going to scoot back from my camera a little bit so you can see what's going on here. And what I'd like you to do is we're going to create 2 bits of awareness first. And the first is I'd like you to clasp your hands and place them on top of your head. And then in this position, as you become aware of the next inhale, normally on an inhale, our spine rides up and down, just gently, not as exaggerated as I just demonstrated. But this time when you inhale, don't let your head go up at all. Don't let anything push directly up to the sky. So inhaling and exhaling. Take 2 more like that, not allowing your head to push up into your hands. You're also not pushing down, by the way, just not letting the spine move. And you can feel, take 1 more breath as I chat away. You can feel how that feels a bit congested and it feels a bit limited. And then the next bit of, wiggle that out. The next bit of awareness is to take your thumbs, place them between your ribs, a little above bra strap level here. And on the right side, I have no trouble getting my thumb between 2 ribs. And on the left side, I can feel the 2 different ribs, but I'm definitely not like between them. There's no like muscular tissue there. So with that awareness, I'd like you to keep your thumbs there. And I'd like you to be aware of the next inhale and let your head float to the sky as that inhale happens. And then exhale, continue to float up, find both of those butt bones, sit on them both, not on just one. Now inhale again and try to open up the ribs on the side that are feeling like there's not a lot of room between them. So inhale, open that up. You might use your thumb to kind of lift towards the sky on that side. And then exhale, wiggle, get taller. You're going to wiggle onto both butt bones and wiggle your head up to the sky. Again, inhale, feel the ribs spreading apart. That's it. Open up the space between the ribs, lift up on the side of the rib cage that feels collapsed. Keep lifting, and then exhale, getting taller. Last time, inhale, open up that space. You can probably feel your whole rib cage realign there. You're on both butt bones, and then exhaling and lengthening up to the sky. Place your hands on both knees or on the table in front of you and keep that lift, especially on that side that likes to collapse down. Keep that lift and hold that for about 10, 20, 30 more seconds before you give yourself a wiggle. That was it. Good work.
Outstanding. Thank you so much. So that's a little preview of body action. And then just a brief word on the third and final component of the scoliosis solution, and that's body whole. So body whole is the component that addresses the entire you and not just the back or not just the scoliosis. So this involves on-demand sessions around mental emotional support, nutritional support. We have 3 ebooks already, optimizing movement choices for scoliosis, postural asymmetries, 20 life hacks for a happier and healthier back, as well as live office hours with experts in a variety of fields. We also have exclusive access to special members-only webinars. And an example of some of our upcoming webinars are focused on connective tissue disorders, scoliosis and osteoporosis, scoliosis and digestion, etc. So just to recap, our members receive all 3 components of the scoliosis solution: body awareness, body action, and body whole. A truly life-changing and revolutionary support to scoliosis care. So what happened to the slides? So just quickly, another component. So there are a few parts to this. So briefly, I want to touch on ages. Scoliosis Solution works very well for men and women over 18, as well as for adolescents between 10 and 18 years old. We also have some programs designed for seniors, with more coming, who may have a hard time sitting on the floor. And these programs are a little more chair focused. Briefly on the benefits, really they're priceless. I like to think of the benefits in 4 categories. So the first is time saving. So this means less driving, less time spent in rabbit holes trying to find people and resources to help. The second is saving money. So without National Scoliosis Clinic, you might see a scoliosis-specific dietitian, a physical therapist, in addition to other therapies. Each of these can run a few $100s and bills add up quickly. The third is unnecessary surgeries. So the fact that you're on here with us today, we know you're serious about taking a proactive approach to managing your scoliosis. And we hope we can provide you the right guidance to eliminate pain and avoid invasive treatments. And then fourth and final, probably the biggest benefit is being present with the people you love, doing the activities you love. Present and active is another way to think about this last category, because you're able to eliminate your pain and improve your range of motion. I've got teenage girls. As I get older, this is front and center on my mind, being able to be around them. Okay, so our final part here, and shifting gears, there have been a few questions that have come up. Here's what our members receive, and here's the value as it is right now. So in body awareness, you get access to our 3D AI scanning app, along with our X-ray reading analysis by our experts, a value of just over $600. You also receive scoliosis realignment therapy, personalized instruction from our therapy experts, live on-demand classes, and a variety of other programs that we calculated at almost $1,100 value. On top of all this, our Scoliosis Solution members receive mental and nutritional support, ebooks, webinars, etc., for a total value and body whole of $681. So patients typically get charged hundreds of dollars just to see a specialist. That doesn't include a majority of the benefits that we're offering you today. So our medical board has calculated all of this value to be at $2,380. That's not what we're going to charge you today. We have a commitment to keep the Scoliosis Solution as affordable and accessible as we can. And so today, our standard price is just over $39 a month. So this includes everything we've talked about: the live sessions, the live feedback, the asynchronous on-demand education from body awareness, live and on-demand of body action, etc. It includes our technology to process all the data, including analysis of the X-rays, AI-based tracking, using the same technology that Tesla uses to see the road. But the final slide. So today, thank you for joining us. It's been about an hour. Appreciate you sticking with us till the end here. And so as a gift for this webinar today, we're offering a 25% off discount for webinar attendees. That is good for 7 days from now. So if you'd like to explore more or sign up, you can click on the link in the chat. It'll be put in the chat right now. And then we get a lot of questions asking if this price is even real. Are we going to suddenly upcharge customers once they sign up? Almost seems too good to be true. And I would just tell you that, do we have a risk-free offering? And the answer is absolutely yes. So the Scoliosis Solution is 100% risk-free, and we offer a 30-day money-back guarantee. So yeah, one more slide. We have, we'll leave this up here. It's 25% discount, NSC 25, open for the next 7 days. And why don't we take time for just a few questions here? Again, we ran a little over. Thanks for sticking with us. Maybe Karena, I'll ask you, there's been a few, and this comes up a lot. Is this similar to Schroth method therapy?
I would say that the Schroth therapy is one component of the realignment therapy that we're doing. Like, it looks similar, I should say. It's not one component of it, but it does look similar. Again, Schroth therapy is one of those historic therapies. It's fantastic. It's incredibly valuable, and we've kind of moved it along, making it very user-friendly and making it so that you can add movement to some of the static positions that Schroth would have you perform. But yeah, so it has some similarities. We certainly are standing on the shoulders of the giants that have come before us, and we are continuing to move forward with the techniques. Yeah, great question.
Here's another. This is a really interesting question. Haven't seen before. Patricia asks, my issue is more imbalance than pain. Is this a thing with scoliosis? Are there exercises to address imbalance specifically?
Yeah, that's a great question, Patricia. Yeah, so if you can imagine that my natural shape wants to kind of hang me out in this position, it's not, scoliosis is not specific to the spine. It does affect us system wide. And you saw that x-ray earlier where the very base of the neck is still trying to, or the very base of the skull into the neck is trying to balance the head, but the head isn't quite balanced, so it's tipped. And so if the head's tipped, then all the stuff inside the ear that is responsible for balance, it's going to be working overtime. So absolutely, balance is something that those of us with scoliosis struggle with. And if anybody on the webinar has, if you look down at your toes and you've got toes that kind of claw the floor a little bit, they call them hammer toes sometimes. We call them parakeet toes. And so if you have that, then you know automatically, even if you're not feeling it, that your body is struggling for balance. And then when you start to realign, those toes are able to flatten. And then of course, the vestibular system up here, your balance system in your head is able to like, oh, okay, I can see the horizon now. Yeah, it's a big thing with scolies.
Yeah, awesome. And maybe last one. What have you, what's been your experience in treating patients with scoliosis, but also symptoms of sciatica or stenosis, other kinds of like nerve impingement type syndromes?
That's like all my experience. Like it's hard to separate someone with scoliosis to someone with, we all have that. We all have that going on. And so again, if I can, the sciatic nerve sits through this kind of, they call it the sciatic notch in the hips, and it has to fit in there, right? It has to slide through there. And if your hips are like sitting over here and your sciatic's like, well, wait a minute, I was supposed to go through that notch, but now I have to take a detour to the right, take a left turn at Albuquerque and find my way through the notch, then things get strained, right? So it's a real thing. And then stenosis is a result. Well, this is something for you, Dr. Gardner, but what we often see is that stenosis is a result of like the chronic inflammation and the body trying to stabilize. And so there can be a buildup. We find that it's very different from person to person, but nerves getting impinged and a tad on the grouchy side is almost a given with scolies.
Fantastic. Well, really outstanding having you here. Great work, and thanks for sharing all of your decades of wisdom and knowledge.
Right back
Thanks
at
to all
you.
sorry, yeah. Thanks to all the participants for joining. Come visit us, nationalscoliosisclinic.com, and join us and start your journey on pain-free scoliosis living today. And we will see you soon.
Thank you so much.